New York City. Lenox Health Greenwich Village. The emergency room. It was 2019. What a wonderful year. As custom and tradition of Lenox Health Greenwich Village. By December, we are all planning for a wonderful 2020. We threw one of the glamorous party of the year on the boat. We dined. We wined. We celebrated. While we look forward to 2020. Then this happened.
Coronavirus outbreak shift here to the United States.
As coronavirus hits the economy.
As the CCP virus works
in Italy tonight, infections are spiking.
Persons around the world, China's export industry is taking a hit.
Well, the coronavirus death toll in the U.S.
If you look at the global cases, they top 480,000. The death toll around the world, more than 21,500.
Aaron, Lexi, I mean, this is the city that never sleeps, but you look at it now, it's a ghost town, isn't it?
Countries and cities on lockdown. It was COVID-19. Then became coronavirus. Then became CCP virus. Then became an epidemic. Then became a pandemic. A new war has begun. Then came new soldiers of war, fighters, warriors, heroes of the new age. Nurses all over the world stood up to the plate. Environmental services. From the radiology technicians, MRI, CT scan tech, and other technicians fought the virus. Lab tech. The EDAs. Doctors stood up to the enemies and never backed down. No, they never did. Just like the nurses, they never backed down. Yes, they never did. Yes, they never did. Just like the EDAs, they never backed down. They never did. And they stood up to the plate. Most of them got sick. They went home. They fought the virus. They came back to the emergency and continued treating their patients.
Bernard Robinson, who runs all of our ambulances in Manhattan and EMS, has been an enormous partner for us, a great partner for everything that we've done since we've been here and since we've opened up. Bernard is really, really great, and he was sick with COVID, and he's back. Today is, I think, his second day back. So, how you feeling, my friend?
I'm feeling great. I'm feeling good. I'm glad to be back. Glad to be standing. It's been, definitely an interesting couple of weeks.
It was tough.
Oh yeah, it was tough. Very scary. But the health system took care of me. I was in Manhasset for about a week, and
So we are very happy to have you back here. So
I'm glad to be back. Thanks.
It's been trying. I can't even define this word. The words are not coming to me right now, but fatiguing is one of the main words. But our team has stuck together. We all put together, and that's what I can say about my team at the moment. It's been from happy to sad. I've been through all the different emotions. It's been mentally fatiguing. So I'm just hoping when this is, over, we are all strong and healthy and just continuing on with what we're doing now. It's like a song that is still playing and just, want to end happily. I just want to see it's all about health. Like I said, I have so many emotions in me right now. I can't even, it's coming out in all different forms.
I love it. It's amazing.
And I'm like trying, happy, sad, all at one time. So, everyone is healthy. I lost a few of my colleagues, not here in Norfolk, but other places. So it puts a lot of things in perspective. A lot.
Thank you. So I'm standing right now with our paramedic manager for CEMS, and these guys have been incredible. Their team is out truly on the front lines, and just want to give you an ability to say something here. How's the pandemic been by you guys?
It's been tough. I mean, my crews have done like an outstanding job. They've been the front lines through this whole thing. No hesitation. They've been going into the calls. As everybody knows, there's been a huge amount of cardiac arrests, and I give thumbs up to my crews. They've done an outstanding job. Along with the whole Northwell organization has been such a great team, and I think we support each other out there. And I give thumbs up to everybody in the organization.
Well, definitely thumbs up to you and all your teams. Thank you so much. Thank you. So up on the 6th floor, which is usually our physician clinic, we've had folks that are both working up here and have left the 6th floor and helped us on other floors. So what has your experience been during this time?
Hi. Well, my experience is I cannot wait for this to be over. It's been really crazy and hectic, but we're trying to get through it. Just going one day at a time and making things happen.
I don't think there's any way that I can explain how crazy the whole thing is. Whether it's a family challenge and I have a young child at home too, having to work on top of that, and husband working from home while taking care of a child. I'm sure this is not a unique experience, but everything about it is just incredibly challenging. But working with a team at Greenwich has made this easier than I'm sure anywhere else it would have been. So I'm just really grateful to get to experience this. Not that it's a joyful moment, but it's very humbling, and it really helps us remind ourselves to be grateful what we have and the colleagues that you get to work together with. So
every morning I walk in, we have security at the door. How has your experience been?
It's good. It's good. We do what we have to do, and everybody's team players here. Everybody's good.
Awesome.
Well, during this COVID crisis, I think it showed how we work well as a team. Everybody was able to come together in spite of any anxieties or fears. We were able to come together to get the testing done, of course, for the patient, and to also make sure that the doctors had what they needed.
We have to recognize during this COVID time that it is lab week, and so Lori has put together a nice amount of food here and Mexican food for her staff. Lori, how are you doing during this time?
I'm doing very well. I have a terrific staff that works for me. We just had to go live and we brought 2 new tests in-house just to test for all the COVID tests so we can go ahead and put a spread to this whole pandemic. And our staff worked very well, great teamwork by all, and I'm really proud to be part of this team.
Hi, I guess I'd have to say it's been a rewarding experience. Food for the soul, I'd like to say, working up on the COVID unit, seeing people get discharged home, seeing all our staff come upstairs to help us fill in gaps, leadership there all the time. I think it's made us stronger, and I think the sky's the limit for the future for us.
I'm just glad to be able to help out. It seems like, things maybe getting a little better. Just glad to be able to contribute.
How's it been during your runs? Have you seen people that are sicker than normal?
I've seen people on both ends of the spectrum. Seems like some are getting a lot better and some just aren't. And, but we're always hoping for the best.
So we have the best EDAs in the world for sure. And certainly the social distancing is tough with this group because they are very, very friendly. But how are you guys doing during our COVID-19 event here?
I think everyone collectively has done a great job at keeping the staff very well protected. We communicate so well with each other, and we're very good at maintaining social distancing. But we do like to be we're a very affectionate group, so it is hard. But I work with the best team. Seriously, some of the most amazing people that I've had the pleasure of working with, and I wouldn't want to do it with in another group.
Awesome.
It's just teamwork.
Yeah.
We help each other. We look out for each other. We have the best managers. They're always there for us,
Hey, how's it going? It's been a really challenging environment and point in time, I think, for anybody in healthcare, but certainly in emergency medicine. But we've had great leadership here at Lenox Health Greenwich Village and at Northwell Health, and we've had the supplies we needed, we had the information disseminated in a timely fashion, and we had all the tools we needed to succeed. And so it gave me and my team the confidence to come to work every day and treat patients with empathy and caring, and make sure that they got the right level of care. And we're happy that we've plateaued and we seem to be on the opposite side of the peak, but we're still staying vigilant and ready for what comes next.
Thank you, Lonnie. Thank you very much for everything you're doing.
Hi, my name's Jay. I'm one of the PAs down here at Lenox Health Greenwich Village. We saw a lot of sick patients, a lot of people, didn't do very well. But, what was reassuring is that Northwell was able to reallocate resources for the best possible outcomes. We were able to turn an entire, basically, outpatient surgical unit into an entire floor for COVID patients in a matter of less than a week, which was, incredible.
One other individual that has been quite amazing through the whole COVID crisis has been Amanda. So she's been up on that floor as a manager as well as in the emergency department. So Amanda, why don't you tell us a little bit about your experience there?
Well, first of all, I just wanted to say thank you to all the amazing people that have helped us out through this. It definitely was not part of your plans, but you were graceful through it, and we really appreciated the positivity. And I certainly appreciated it every night coming in. That's what really got us through. This was an experience like nothing else that I've ever dealt with before. A lot of us have dealt with life and death in our careers, but something like this will have us bonded forever. And I really, again, from the bottom of my heart, I really thank you guys for being positive and helping out. It meant a lot, and it's really what got these people through this tough time.
During any crisis, what do you need? You need security, no question about it. So Ray, you guys have done a phenomenal job during this entire crisis.
And I would like to say thank you to everyone who have a hand, no matter how small or how large role you may play in this crisis. And yes, we will get through this. We all will get through this safe and secure. Thanks.
Thank you, Ray. Yeah. Thank you very much for everything you guys do. Oh, I'm up here in our new COVID unit in LHGV with Dr. Richard Whalen from Lenox Hill Hospital. and with PAs that came here from Lenox Hill as well to make this service work. So they're telling great stories about how it is to come onto a unit with all brand new staff that didn't know each other before to do the good work that they're doing. So, Rebecca, Amanda, and Queso.
He's a new ortho intern, actually.
Oh, that's awesome. Tell me a little bit about your experience. Here, you can even hold the phone, so it'll be much more.
I didn't have my glam squad this morning.
We were just saying that we are very happy with how things have been going at Greenwich Village. It's been a beautiful experience. The facility is very nice. It's very pleasant to work in, and the staff coming from all different specialties, all different experiences have all been very proactive and coming together beautifully to work together. Everyone's eager to help out, and it's been making the experience very pleasant for us in a uncertain time. So it's been nice. So thank you.
Amanda? Just more of the same. Everybody from all different experiences, backgrounds, everyone's working together. And if we don't have the answer for something, which we're bound not to after doing this in like a week, putting this together, we figure it out as we go, and it's working. It's great. It's enjoyable, and we're making a difference. So.
You are definitely making a difference. Dr. Whalen, sir, as you are doing a different role as a hospitalist, how has that been during this time?
Well, it's been great to also meet the staff from every department you can imagine, and work with hospitalists who I otherwise didn't know, and meet the intensivists who are doing an incredible job at Lenox, especially in terms of coming up with protocols that are working very well. But also, it's great to know that the Greenwich Village facility is here. I'm happy to visit. Thank you for having me down, because when we're transferring patients to other facilities, the comfort and the Javits is one thing, but it's nicer to be able to do kind of an internal transfer with people that you know, and the PAs I'm working with all know you guys, so you feel much better about transferring folks out when they need a step down with a slightly lesser acuity setting, but if there's a problem, they can get back in. So I think it's a great place, and I also can't believe how you've retooled the whole place. I mean, that's in New York construction. It never happens that fast.
When you take away the regulations, you can do amazing things. I am here with the NISMAT physical therapists that did most of their career in ambulatory, and came to help us out on our LHGV COVID unit, and had some quite interesting experiences here, different than they've had in the past. So.
Working here is wonderful. The staff are great. Nurses, PA, everybody here is our wonderful support staff.
I'm Katie. It's just been quite a transition for us to go from outpatient to inpatient, and everyone here has been fantastic and easy to work with and super supportive. So I'm grateful.
So what's your feeling going from an ambulatory setting into an inpatient setting with some end of life, some palliative care, some folks waiting to get back to either home or a skilled nursing facility or acute care?
I mean, I went back to my textbooks.
It's been a great experience getting these people home, first and foremost, and seeing the look on their eyes and how grateful they are for our help. So it's been awesome.
Normally we're reducing fractures in the ER, scrubbing in orthopedic surgery, and covering orthopedic inpatients. It's been a whole new ball game here. A lot of anxiety at the beginning, but amazed and happy with how we've pulled together and we're able to manage it here, I think, successfully. At some point, we're going to get back to what we normally did, but I greatly appreciated the time here, made some new friends, and, really see that, when you have an objective, when you have a goal, anything's possible.
I'm Tiffany. I normally work as a surgical PA at one of our outpatient facilities, and I was completely out of my comfort zone working with floor patients, but this place has been wonderful. Everyone's been great. The nursing staff coming from PACU, the ED, they've just been wonderful.
I am Erica. I'm a PA, usually in plastic surgery. This has definitely been out of my comfort zone. But things have it's been a smooth transition. I felt very supported the whole way, very safe and protected. Everyone has been really good about asking, making sure we're okay. okay, if there's anything we need, if there's any suggestions we have. It's been very open communication-wise.
And the community has been so great. We've been so fortunate to have the community being so supportive, and also a lot of people are being very good about staying at home and not coming in for minor things, and we're able to give attention to the patients that are here for COVID. So it's been great.
You are incredible.
Stay home, stay safe. Yeah.
Oh, thank you. So I'm here in the emergency department with Dr. Carujo and Hannah. And Omar, I will tell you that I was watching you intubate a patient about a week and a half ago. And I looked at it and I had two thoughts in my mind when you were doing that. One was the team was absolutely amazing. You guys were like a well-oiled machine going in there and taking care of this patient and guiding her through this process, and her family, because she called them on her cell phone. I just thought that was amazing, that you guys all knew your spot and took care of this just so expertly. The other things I thought, God forbid that was me on the other end of the phone, and how would I handle that?
Well, this certainly has been a very tough period in the emergency room, I feel, and also for the admitting teams and for medicine in general. But we're very, very lucky where we are right now at Lenox Health Greenwich Village. We have a team that in moments like this comes together. We come together as a team, as a family. We support each other, take care of each other, which is what we've been taking care of. It's very, very sick patients we've been getting. And so I'm really, really proud of the work that we do here and how we've been able to, together as a family, to deal with it.
Hannah, one of our amazing physician assistants here. How's your experience been through the COVID pandemic?
Yeah, I mean, it's definitely a challenging time for all of us. It's amazing to see how all of us can come together and just, take this challenge on together from, within our team here in the ER.
It's been, extraordinary. It was interesting that the team that really put this unit together had been together when we opened the ED, and, working with you and Dr. Cruzen opening the ED, I learned a lot about workflow design, and being a freestanding ED, we sort of had to invent a lot of what those workflows look like because it didn't exist before. So when you're opening a hospital unit within a freestanding ED, which made us a hospital now, I can't really call us that anymore. A lot of that stuff I learned from opening the ED, I just was able to really transition to getting the unit operational from a patient care perspective. Francis Lee also is a great partner in terms of understanding workflow, so we were able to fuse like the clinical stuff and her administrative knowledge, and I think it really made the whole operation up there run really smoothly.
When it was determined that we were going to open up a 31-bedded COVID unit here at Lenox Health Greenwich Village, and that much of the patients coming through could potentially be end of life, DNR, DNI, we sat around, myself and a few of the leaders here, and I made the decision that we would be the ones to take care of any decedents that unfortunately occur here. And Patrick Smith, who's here with me now, is the individual that I asked to really take control of some of this and be the manager for the morgue that's outside. So this has not been easy, certainly, and Patrick has had a tough job, but he has done it with complete dignity and respect. And I just want to turn this over to Patrick and ask him to say a few words.
The role, as unique as it was, needed to get done. And my opinion at the time, along with Alex, was that it shouldn't be a burden that the staff who are already strained has to bear. So taking on the role
was something I took very seriously to ensure that all of our patients who passed were treated with dignity and respect in this terrible time. Our disaster morgue luckily did not get to capacity the way that many other hospitals around the city have, and we were kind of blessed in that way. But we, Alex and I and Vinny, did our best to treat the patients with respect and keep the public out of view of our process. So something that 10 years working EMS, we always talked about could happen and prepared for, but never thought we'd ever actually see. So, in times of need, everyone just needs to step up, even if it's a little bit out of your comfort zone. And that was the decision I made with Alex.
So I would like to take this opportunity to thank every Lenox Health Greenwich Village employee and others that have helped out during this COVID-19 crisis. This pandemic has been something that we have never seen before. It's unprecedented. And our employees, all of you, rise to the occasion whenever anything like this arises, anything even close to it. You rise to the occasion and you set the bar really high. And I just want to take this opportunity to say thank you for everything that you're doing. The emergency department has seen the highest acuity I think you've ever seen in a given time, and handled it like absolute professionals and the caregivers that you are. We were able in this facility to build a COVID positive hospital unit in an ambulatory surgery center in a little over a week. And we were only able to do that because of the amazing leadership in this building. And many of you that were involved spent weeks on end here, 7 days a week, and were sleeping in hotels in the nearby neighborhood. So I just want to say thank you, because what we've been able to do here is truly humbling and something that I am incredibly proud to be a part of, and always have been. While there have been some very difficult days here, I think this is something that we should all be very proud of. The fact that we were able to come together to bring other folks into our family on a temporary basis to take care of very sick patients. And I want to thank you so much. You are incredible. You are healthcare angels. Thank you.